So my research is based on a 13-point acupuncture protocol that I used that was recently published in the Journal of Sexual Medicine. And so that is the study. I've recently been funded from the National Institute of Health. I was funded for $2,036,000 over 5 years to study the treatment of vulvodynia with acupuncture. So we're just beginning to start recruiting for that study now. And because of that, we will use the standardized protocol where I've shown that there's some efficacy or effect for, that there's a strong efficacy for, and we will move forward with that protocol. But if one uses that basic protocol to treat a vulvodynia patient, regardless of their diagnosis, regardless of their traditional Chinese medicine diagnosis, patients will have a strong reduction of pain and reduction of pain with intercourse.
So for, being that this is not a topic that I think a lot of women don't bring it up or are very either ashamed or uncomfortable to talk about it, especially with a non-medical person, but even sometimes in medical interactions. If someone's listening right now that has vulvar pain or that genital pain, you're speaking of vulvodynia, what qualifies them to be part of your study?
So, right, it is the vulvar pain of vulvodynia. So right now for the study, they have to be diagnosed with vulvodynia, and they cannot have any other reasons for vulvar or pelvic pain. So some of those reasons would be if they've had, like a cut or trauma during childbirth that they've had chronic pain for, if they've had any kind of injury that has caused any nerve entrapment in the vulva or the pelvis, endometriosis, or any other forms of pelvic pain such as irritable bowel, interstitial cystitis. We say these are comorbid syndromes or pain syndromes that present with vulvodynia. I had mentioned some of them: irritable bowel syndrome, interstitial cystitis, but also TMJ, temporomandibular joint disorder, chronic migraine headache. These have all been implicated because of the pain pathways as associated with vulvodynia. So we're asking for women who do not have active other pain syndromes that are associated with vulvodynia. We want to just look at pure vulvodynia pain. Also, too, if women are in menopause, they're not eligible because so many changes happen, and often because of the the decrease in hormones, there can be pain or discomfort in the vagina or the vulva.